Thank you, Lascan Corley. This is a budget like no other. It is being introduced in the context of events which are largely beyond all our control. Certainly, no one would have chosen the circumstances in which we find ourselves. COVID-19 and Brexit are the twin challenges of Budget 2021. And what is critical now is how we respond to those challenges. If I may just say, Lascan Corley, just a few minutes late, that I hope to share my time with my two colleagues, Deputy Cian O'Callaghan and Jennifer Whitmore. I'll take 30 minutes and then 2 7.5s. Thank you. People who face insecurity, COVID and non-COVID health concerns, loss of income, worries about schools and all kinds of services will look to this budget in terms of what certainty government can now provide. I think they'll be disappointed. There is a need for government to focus relentlessly on the public interest and the public good. This means very clear and determined action to drive down the incidence of COVID-19. It means income protection for those who have lost their jobs. It means targeted supports for those sectors most impacted by COVID. It means substantial investment in universal public services. Most of all, it must be a budget which offers hope. We entered this pandemic with a country, a society that was ill-equipped to deal with the consequences. So this budget must be about surviving the ongoing impacts of the pandemic, while reviving our economy and society to take us through this exceptionally difficult time and through to better times. We are also approaching this task with a radically changed attitude and approach by the ECB, as well as the European Commission. At a European level, it would seem that lessons have been learned from the last recession, where on that occasion there was an obsession with deficit reduction and responding with austerity, causing devastation for so many people. So the message is to spend extensively in order to invest and grow our way out of this crisis. That has been hugely facilitated by the decisions of the ECB to facilitate very cheap borrowing. And of course, that spending must be done wisely and productively to meet those two objectives of survival and revival. The consequences of decades of underinvestment in public services and an often cavalier approach towards public provision have been laid bare as a result of this pandemic. It was patently clear that leaving key public services to the market, a privatised way of doing things, as practised by this and previous governments, left us exposed and very vulnerable. The government parties have come late to the acceptance that we must build up our public services and that we can afford to invest in the future of our society. In the early months of the pandemic, it became very clear just how underfunded and underdeveloped most of our services were. The government was forced to urgently ramp up those services to enable us to respond to the virus. But those changes, the expansion of services, the additional funding, the extended involvement of the state, now need to be embedded in how we make post-COVID plans for the development of our public services. There can be no going back to the kind of policies which left so many people exposed to insecurity. The clear priority and focus needs to be to provide adequate investment in the public provision of those key services, as well as addressing the ongoing deficiencies in how we respond to COVID. The presence of COVID, the escalation in the rate, the implications, the fears, the response are things that dominate our lives and are likely to do so for some time to come. Responding adequately, breaking the chains of transmission, driving down the virus, while at the same time protecting the most vulnerable, must be a key priority. Most people are working very hard to comply with the public health advice and the severe restrictions that have been imposed on everyone. But increasingly, there is a sense that government is not adequately playing its part. Why is it that 7 months in, we still don't have a properly functioning test and trace system? Why did proper staff recruitment start so late? When will we get the rapid turnaround time necessary for our testing system? Why are we not doing long tracing to establish the place of transmission? It is very hard to understand why we haven't addressed the issue of travel, and why are we not ready to join the EU traffic light system with a proper testing or quarantining arrangement. And there was no mention of that, no mention of the huge difficulties faced by the aviation industry in today's budget. Why are there not clear messages tailored to different cohorts to ensure that the public health advice gets across? And why, after 10 years, the recommended number of critical care beds are not in place? It is very disappointing to see in today's budget that funding has been provided for only 66 additional critical care beds, when we know and have known for the past 10 years that there's a shortage of at least 250. The gross neglect of public health services and the severe inadequacies in the system have resulted, as we all know, in completely unacceptably long waiting lists and denial of access to timely care for very large numbers of people in our country, both in terms of community services and hospital services. These chronic problems in our health service have now seriously hampered the country's response to COVID-19, forcing the state to secure additional emergency beds from private hospitals at very significant cost. New demands on service delivery, infection prevention and control, and social distancing have put further extreme pressure on a system that was already operating way over capacity. Ireland has never had a fully functioning health service. There has never been any excuse for this either, and there is certainly no excuse today. The Sláintecare plan to reform our health service was published in 2017. It should now be in its 4th year of funding, but instead it has never received the kind of substantial funding or backing from government necessary to implement it. What matters now is what happens next. It is vital to ensure that the additional funding now being allocated to the Department of Health not only caters for future surges in COVID-19, but is also invested in a way that brings about the much-needed system of reform set out in the Sláintecare plan. While the headline figure of €4 billion for the health service is a very substantial one, it's important to look at the detail of that and to realise that more than half of that sum is going to continuing with the testing and tracing system and to ensuring adequate levels of PPE, as well as other aspects of responding to COVID. That leaves less than €2 billion for the health service, and a large proportion of that relates to capital investment, which we had already heard about. Two key elements in relation to the very principles of a properly functioning public health service, as set out in Sláintecare, are very clear. We must ensure that we shift activity away from the acute hospital sector to the community and primary care level. Very little mention of that today at all. No provision for the kind of additional numbers of staff, GPs, nurses, therapists that are needed at community level, not only to address the long waiting lists there, but also to ensure that we can achieve the kind of reform set out in Sláintecare. And the other element of that, about ensuring that we remove the obstacles to people being able to afford to access care, so that we remove the cost element. And again, no progress at all made in that today in terms of extending access to free GP care, to medical cards, or indeed to reducing the cost of medication. It's really important that we move in that direction. And in spite of the lip service given by the government to the implementation of Sláinte Care. Unfortunately, those key elements are not going to be addressed by the announcement earlier on today. It is only at the point where we actually grasp those fundamental principles in relation to having a proper public national health service that we will actually start to make progress. And, you know, government has signed up to Sláinte Care, but it is disappointing to see the slow progress as a result of today's budget announcement. In the area of childcare, COVID exposed the extreme precariousness of a privatised model of childcare, where the state had to step in to pay the wages of staff and subsidise providers during the pandemic. An obvious failing in this budget is that there remains no pathway to the kind of national childcare policy which would guarantee quality, affordability for parents and decent pay and conditions for childcare workers. We have traditionally completely underinvested in this area. The state stepped in during the pandemic, and we should have looked to embed those changes that were made at the height of the pandemic in order to achieve the kind of reform which is so badly needed. But regrettably, the government today has not availed of that opportunity. In the area of education, we're now counting the cost of having an underfunded education system, leaving us with the highest classes in Europe. We know only too well of the inequality which exists in terms of education outcomes. We know of the uneven access to college and third level generally, though through the efforts of many, participation rates have been improving in recent years. In third level, the weakness of a model which relies far too heavily on fees from overseas students has also been exposed by this pandemic. The investment in education in this budget is welcome, but not of a sufficient quantum to make a very real difference. It falls far short. Someone decided to get the news in early that the government would introduce funding to bring class sizes down. But we have to remind ourselves that within the OECD, that the average class size is between 21 and 22. An OECD report last year placed Ireland in joint last place out of 33 countries ranked in terms of investment in education as a percentage of GDP. And today's budget does not get us very further down that list. The context we need to view the government figures in today are of a situation where nearly €20 billion is being spent. And in that context, the allocation to education is very disappointing indeed. Chronic underfunding of social care too, and the light touch regulation of the privatised nursing home sector have clearly failed over older people, not only during the COVID crisis while it was at its height, but over many years. These policy failures have created a very real danger for older people in this country and tragically led to many deaths that may otherwise have been preventable. Equally, the underfunding of home care and its deregulation has resulted in long waiting lists for care in the home and ongoing delayed discharges from hospital. While there was some allocation in relation to home care in the winter plan, that will merely help to address the current waiting lists, but will do nothing to the expected substantial increase in waiting lists throughout 2021. And in addition to that, we urgently need a statutory entitlement to home care. In relation to employment then, we entered COVID-19 with an economy with high levels of insecurity, a prevalence of low pay, and a real lack of certainty for many workers in terms of their working lives. We needed to see recognition for our essential workers in this budget, in the very least in terms of access to a proper sick pay scheme and addressing the low-wage economy. At a bare minimum, all our workers need to be paid a living wage, and there needs to be a sick pay scheme which protects those workers, particularly in those areas where many of our workers have been seen to be at serious risk. And I'm talking, of course, about those workers in meat factories who felt that they had no choice but to continue to go into work when they were feeling unwell because of the fact that there was no guaranteed sick pay scheme. Equally, in relation to an awful lot of the care assistants in nursing homes, who again were living and working in very precarious circumstances and didn't have the luxury of taking time off when they felt unwell because of the absence of a sick pay scheme. And we paid a big price for that. Rather than kicking the can down the road, the government should have and should now bring employers and workers round the table to thrash out a fair sick pay scheme. This is a matter of public health, particularly for those vulnerable workers that I referred to, but it is also a matter of justice for them. Everyone should have security in their income if they get sick. In relation to the area of mental health, the severe adverse impact of COVID-19 on the nation's physical and mental well-being cannot be overstated. A recent surge in referrals as a result of COVID-19 has put new demands and extensive demands on mental health services, which were already chronically underfunded over recent years. Coupled with long waiting lists to access mental health care, providers have been left completely overwhelmed, and people who are in serious need of urgent care are left waiting even longer. Budget 21 needed to make a serious investment in mental health services to address these historic shortfalls and to make up for the additional resources now needed to grapple with COVID-19. There was a requirement for a figure of €80 million to be invested in mental health services. It is extremely regrettable that the budget has provided for less than half of that figure. The pandemic has presented challenges across all of our society, but people with disabilities, their carers and organisations that provide social care and disability services have felt its effects particularly severely. We know that day services were very badly affected and are very, very slowly coming back on stream. Today's announcement in relation to additional funding for disability services is very welcome. I warmly welcome that, and it's not before time that that kind of allocation was made. I would raise one particular issue of concern, though, and that is the question of cost of disability payment being made. It's been a demand by people with disabilities and advocacy groups for a very long time that those additional costs that result from having a disability in terms of heating, special diets, adaptation of a person's home and so on. And that's why there's a very, very strong case there for a cost of disability payment to be made. And regrettably, people have to wait yet again for consideration of that payment. In the area of housing, my colleague, Deputy Cian O'Callaghan, will be referring to the issue in more detail in a few moments. But nothing illustrates the failings of successive governments in public policy like this country's approach to housing. Policy driven by special interests, not the public interest, has long been the hallmark of this country's approach to housing. This budget completely fails to address a key issue in housing, and that's affordability. It takes no account of that whatsoever in relation to those who are renting or those who are purchasing. And the tokenistic element provided in the budget of a mere 2,000 affordable homes is really derisory. What government should be doing is setting out very clearly with a range of policies to drive down the cost of housing. But yet again, this government, headed by Fianna Fáil, and indeed the last government, with the combination of Fianna Fáil and Fine Gael, have completely failed to grasp the nettle in this regard. I'd also say that, the two measures, Help to Buy and stamp duty, just reinforce the problems that are there. They are effectively subsidies to developers, and expose what I believe is a complete misunderstanding of the nature of the housing problem in this country on the part of the Minister and his government colleagues. In relation to income support then, the two big policy responses in the area of income supports have been the introduction of the PUP payment and the employee wage subsidy scheme. These were brought in at great speed, which was the correct policy response at that time. However, there's a clear danger that withdrawing those schemes too early or reducing the rates or the terms of those schemes will hurt the very people who availed of them and will also hurt our wider society. At the very least, we should have maintained the PUP rate into the future, and we should not have put a time limit on its payment. People need guarantees around their incomes, and that is absolutely necessary for people in order to have some sense of security and to make plans for the future. The employee wage subsidy scheme needs to be correctly targeted to ensure that workers in the sectors who need it most can avail of it into the future. And I would have to express some concern that today's announcement about extending that to the end of next year is not on the current terms of that payment, and I await further detail on what changes exactly the government is proposing in that area, because I would be concerned. It has been a very successful payment and we should be continuing it under the present terms, at least till the end of next year. COVID-19 has demonstrated with great clarity that you can't separate economic policy and the provision of public services. The assumption made by some that you fund public services as some kind of afterthought to economic growth has been totally undermined by the pandemic. Good quality, strong public services underpin the economy and our society. The consequences of decades of underinvestment and separating the economy and public services from society have been laid bare. The positive connections and having a robust community where people look out for each other are now very clear to see over recent months. The sense of solidarity across society has been essential in responding to COVID-19. The Social Democrats have long since insisted that we live not only in an economy but also in a society. This means that we see the economy and society as being inseparable. Strong investment in public services can sustain positive economic benefits, and fairness and equality of outcome are principles which should underpin all our economic policy. If the state can intervene, and it is absolutely right that it should, to provide certainty to businesses, it must ensure that this process is fair, and it should also include, of course, the voice of employees in those businesses. We have to ensure that the money is spent in targeted, effective ways and not wasted. We'll await further detail, and my colleague, Deputy Catherine Murphy, will be responding further in relation to business supports tomorrow. Another important area in this budget is the whole question of carbon tax. There are parts of this budget which we welcome, undoubtedly, and we support the steps being made in increasing carbon tax as a means of changing people's behaviour in respect of the environment. But accompanying the commitments on a carbon tax needs to be a commitment that people on low incomes will not be punished financially. Increases in the fuel allowance and the living alone allowance announced in today's budget do not fully offset the cost of the $7.50 increase in carbon tax. It is very important to bear in mind that the number of people in receipt of one or other of those payments is limited. It's likely to be less than 1 in 4 people. And there is a glaring omission in today's announcement in terms of a failure to introduce offsetting measures for working families, all those many families who are the working poor, as they have been referred to. People on very low incomes trying to support families and number of children at a time when the cost of living is increasing. And we should have introduced a measure to support those low income families, because introducing a carbon tax should not be for one moment about impoverishing those who are least able to carry that burden. Budget 2021 includes many measures, as I say, to support businesses and employment, but they must also be accompanied by measures which support decent and secure work. And that is why, in addition to the basic requirements for a sick pay scheme and also to a move towards a living wage, we must also improve people's quality of life in respect of work. Part of that should, of course, be ensuring that we introduce a legal right to collective bargaining. The government has dodged this issue for a very long time. And we're now, at a point where there's been a lot of recognition, a lot of praise heaped on those essential workers who have kept this country going during the most difficult times over the past year. But, that is hypocrisy unless we're prepared to take the next steps to provide secure employment, to provide for collective bargaining, and to give workers the right to fair representation in the workplace. There are also other issues that we need to address in terms of the world of work, and that means looking at the whole area of the right to flexible work options. And I think the experience over recent months has shown that people would like very much to have greater access to flexible work options, and that's why the Social Democrats are proposing a commission that would be established to examine that whole area and to make recommendations on how we can move towards a situation where we can introduce a statutory right to flexible work options, including a 4-day week. Staff working from home, of course, now more than ever need the right to disconnect, to prevent overworking and to safeguard their mental health. We need to ensure that, given the experience of the last few months and the lessons that need to be learned, that there is no going back to the kind of dysfunction that we saw pre-COVID-19. We need to ensure that our society improves as a result of the lessons that have been learned over recent months. And the main element of that is to learn the lessons about the provision of public services and ensure that they are adequately funded. Today's budget doesn't go far enough by any means in terms of learning those lessons. It doesn't help in relation to the cost of living either. And those two main areas that impact so much on the cost of living, the cost of housing and the cost of healthcare and the cost of childcare in addition to that, are key elements which needed to be addressed today. Unfortunately, they weren't. The government did not avail of that opportunity. There was no excuse for that. We know that there's almost endless borrowing available at very low interest rates or indeed negative interest rates, as we've experienced in recent times. The government should have availed of that very important opportunity now. It should have borrowed more extensively, and it should have raised taxes from those areas that can afford to increase their contribution to our society. That would have enabled us to go much further in terms of the reform and the extension of public services. It would have enabled us to do something really meaningful in relation to housing and healthcare, and it would have enabled us to provide the necessary funding for mental health services. Unfortunately, those steps were not taken. There is still a mindset there in Fine Gael and Fianna Fáil which is hung up about deficit reduction. And I am really concerned about the comment that the Minister for Finance made earlier this evening about returning to concentration on deficit reduction at the end of next year. That is not the mindset that is required. That is not the approach that is required, not only at this difficult time, but into the future, if we are to develop our economy and our society to be inclusive for everyone. People need hope that lessons have been learned and that a better economy and society can emerge. The budget will be judged by whether the government did that today. I believe that they have failed to do so. Thank you.
Thank you very